She hasn't shown up yet. Come up. Put my bag over.
Yeah, right in the bag.
All right. Welcome, everyone. Thank you all for being here. Look at all these beautiful people on this muggy day, right? It's so great to see community. It's so great to feel the support. So thank you all for coming. Well, first, we'd like to thank our city council members for joining us and being supportive of all the work that we're doing. I'd also like to thank the Hep-Free NYC Coalition, Hispanic Federation staff, and the planning committee that put this event together. Thank you all, an amazing event. I'm Betsy Morales-Reed, by the way, and I'm with Hispanic Federation, just in case you wanted to know who I was. But yeah, so we know that New York City has a plan to eliminate viral hepatitis, right, as a public threat by 2030. And we have the tools to do that, okay? The way we can do it is by eliminating some of the inequities for access to care, for treatment or cure, right? And to expanding vaccination and screening. So we have the tools to do that. We have the folks here that are ready to work for it to make sure that it happens. So by us standing here today during the month of hepatitis awareness, right? We're also here a day after National Hispanic Hepatitis Awareness Day, which was yesterday, May 15th, and a couple days from National Hepatitis Testing Day, which will be on May 19th. We're here to make sure that we're elevating our voices and the work that we're doing to make sure that we reach this and we get to eliminate viral hepatitis in our city. And without further ado, I would like to introduce our first speaker for today, and it's Dr. Sarah Brunstein from the New York City Department of Health. Thank you so much, Dr. Brunstein, for being here.
Why you didn't get my microphone? I don't get it.
Good morning, everyone. Thank you so much for the invitation to be here in this discussion. As mentioned, my name is Sarah Bronstein. I'm the Assistant Commissioner for the Bureau of Hepatitis, HIV, and Sexually Transmitted Infections at the New York City Department of Health. In this role, I have the privilege of overseeing our efforts to eliminate viral hepatitis in New York City. In December of 2021, the New York City Department of Health released its viral hepatitis elimination plan, which proposed 3 goals. 1, to reduce new hepatitis C infections by 90% by 2030. 2, to reduce premature deaths among people with chronic hepatitis B and chronic hepatitis C by 65% by 2030, and improve the health of people living with hepatitis B and C. And 3, to reduce health inequities related to viral hepatitis infection. Since the plan's release, the Health Department and our community partners, many of whom are represented here today, have worked tirelessly to implement the plan and achieve its goals. In January, we were pleased to announce that from 2021 to 2022, there was a decline in the number of newly reported cases of chronic Hep C in New York City. While there was an increase in newly reported cases of chronic hepatitis B from 2021 to 2022, the number of cases in 2022 was close to the level seen prior to the start of the COVID-19 pandemic, which may reflect ongoing catch-up of new diagnoses of chronic Hep B not made as readily during the height of COVID-19. Inequities by gender, neighborhood poverty level, and age persist in newly reported cases of chronic hepatitis B and C in the city. Among people newly reported with chronic hepatitis B in 2022, 58% were male, 49 were ages 30 to 49, and 40% lived in neighborhoods of high or very high poverty, and 39% lived in those neighborhoods. New hepatitis C cases among young people are more likely to be infections due to recent exposure through sharing drug use equipment. To eliminate hepatitis in New York City as a public health threat by 2030, we must work to dismantle racism, sexism, homophobia, transphobia, xenophobia, and other systems of oppression.
Anti-Semitism too.
That we
Anti-Semitism.
serve as barriers to health and health care for people affected by hepatitis. More than 329,000 people are estimated to be living with chronic hepatitis B or chronic hepatitis C in New York City. Over 1/3 of whom are still unaware of their status. And this just highlights the need to further promote hepatitis screening, particularly among groups who may not think they're at risk. So we guide our efforts by these data. The New York City Health Department has continued to invest in programming and services to reach our viral hepatitis elimination goals. For example, during the last cycle of our City Council-funded viral hepatitis initiative, we supported community organizations to provide hepatitis B and C prevention services, linkage to care, and training. From July of 2021 to June of 2022, 32 organizations provided health education and linkage to care services for over 3,000 people at risk of or living with Hep B or C. And they supported the training of over 200 peer and patient navigators and over 1,100 clinical providers in hepatitis B and C prevention, testing, linkage to care, and evaluation and treatment. In 2022, our telenavigation program, through our that program, the health department called 989 people with Hep B or C to offer healthcare navigation services, and our perinatal Hep B prevention program provided linkage to care and case management services to 651 people with chronic Hep B and their infants to prevent inheritance transmissions. And finally, in 2022, the health department partnered with an outpatient primary care clinic to offer Hep C treatment via telemedicine to 2 inpatient substance use trainees experienced in treating opioid addiction, and we facilitated healthcare practice projects and substance use treatments with high hepatitis C screening rates. I am immensely proud of these efforts and other efforts of the work of our viral hepatitis program and all of our community partners, without whom we could not do this work. The work of everyone here and out in the community today is incredibly admirable and, of course, paramount to the Bureau's mission. Together, we look forward to a future without viral hepatitis as a public health threat. Thank you so much.
Thank you, Dr. Bronstein, and thank you so much for the New York City Department of Health, the New York State Department of Health, and all the work that's being done to make sure that we achieve our goals. So I'd like to now introduce Councilwoman Lynn Shulman. Thank you.
So we want a hep-free New York, right?
Yes.
So I'm chair of the health committee, and I'm glad that that DOHMH went first, because she reminded me that the city council pushed to make sure that we had funding for hepatitis in the last year's budget. We're going to make sure we do it again this year. It's so important. I had a loved one who several years ago passed away from hepatitis C, and that didn't have to happen. So this is something that's very personal for me, and I'm going to make sure that I do everything I can to make sure that we have a hepatitis-free New York. And I'm part of Healthy NYC, which is a city program, but also I codified it in the city council so that it goes on in perpetuity to increase life expectancy to the age of 83 by 2030. That includes making sure people do not have hepatitis. Woo! So, yay! Right? So, and by the way, I want to point something out. Usually, when we have these press conferences, it's the city council and it's the advocates. But we have the administration here. We have DOHMH, so that shows their commitment to this. So I want to point that out, right? And we need to applaud that. So thank you all. I'm not going to take up too much of your time, but it's so good to see all of us.
Thank you, Councilwoman Shulman. Thank you so much for your support. I'd also like to introduce Councilman Eric Botcher.